What we're seeing now more than ever in sort of the field of psychology is we're seeing a lot of those longer term effects from COVID. So we're seeing things like there's almost a cynicism to people. People are a little tough around the edges.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Today, let's be real. People are angrier. There is a definite change or shift in people's behaviors. They are more frustrated. They have a heightened sense of entitlement. In my last 16 years of practicing, I definitely feel like it's at its peak right now. Sometimes going to work is stressful, knowing that patients are going to be angry or upset with me. But I also see the flip side. I also know that when I go to my healthcare providers, that sometimes they're angrier with me or more frustrated with my problems. So what's going on? Has this gotten worse just because of COVID? Why this shift in patient behavior or people's behaviors? I have an expert guest with us today, Dr. Nina Mafrici. Dr. Nina Mafrici is a clinical psychologist and co-founder of Toronto Psychology and Wellness Group, where she supports individuals with various mental health challenges. She also serves as a clinical consultant for various schools and organizations. So please welcome Dr. Nina Mafrici. Thank you, Dr. Mafrici, for being with us today. We're really excited to have you.
Thank you so much for having me. And call me Nina.
Okay, call you Nina for sure. So tell me, like the healthcare field, I'm going to say is struggling for sure. There's that change in patient demands, patient behaviors. I know it's a broad question, but why?
Yeah, I mean, I think it's a loaded question. So I think there's a lot of reasons why there's increasing demands on healthcare providers and the profession in general. Like we certainly saw a lot of shifts happen in around COVID. And I think, it wasn't that COVID suddenly, changed our healthcare system or the landscape. I think COVID showcased a lot of the holes in the system, in the existing system. And with that came, one is way more demands and pressures on healthcare providers. So, I work with a lot of healthcare practitioners who I treat, and many of them in COVID were being asked to sort of leave a department that they're been accustomed to for many years and to go and help out in things like the ICU or doing, installing ventilators and things like that. So it was a really taxing time for, I think, a lot of healthcare providers, and demonstrated just how strapped we are as a system. And I think because of that, it also changed how people viewed healthcare and the demands that they have of our healthcare system. I mean, it's good that we demand a lot, I think, of our government. And I think people are unfortunately, putting a lot or projecting a lot of their anger and frustration out on healthcare practitioners as opposed to the government and trying to lobby for actual changes, systemic changes that are going to help our healthcare providers and are going to help our healthcare system in general.
So tell me, like me as a provider, I'm seeing patients daily, and like you said, their anger or their frustration is directed towards me, even when we are trying our best, right? I mean, we are, we're booking eye exams less, more further apart so that we can spend that time and take that time to talk to, our patients, their parents. So where has that sort of shift in appreciation gone? Or that how have patients become so entitled, or their parents? Like why that shift? It used to be that they'd appreciate us, and now it's completely shifted.
Yeah, I think it's twofold. I think on one hand, I think there's been a lot of pent up frustration from the time of COVID. So we had a lot of individuals who, for instance, whether they themselves experienced healthcare issues during COVID or lost loved ones, had loved ones, struggling to navigate the system during COVID. I myself had an elderly parent trying to navigate treatments during COVID, very, very challenging. And I think a lot of people carried many of those frustrations from that time. And now when things are more open and they're able to book with providers, it's getting dumped on them, right?
Yeah.
So I think there's that aspect. I also think that COVID, and I don't mean to harp on COVID, but COVID was a really significant global event that changed all of emotionally.
Yes,
right?
absolutely. Absolutely.
I think it puts a lot in perspective for people, but it really, what we're seeing now more than ever in sort of the field of psychology is we're seeing a lot of those longer term effects from COVID. So we're seeing things like there's almost a cynicism to people. People are a little, tough around the edges, rough around the edges. They feel, yes, there's a sense of entitlement, I think, for a lot of people. I think that people have gotten a little bit harder in how they interact with the outside world. And some of that's been due to the fact that for so long they didn't have to interact with as many people. Yeah. And so a lot of people lost things like social graces and respect and respectful communication. And then, it was also that entitlement that stemmed from a privilege of people who are able to afford things like private services where, I knew people that went to the States during COVID and there they accessed and paid for private healthcare. They come back here and they think it's preposterous that we don't have something where they can immediately see a provider. So, within the public sphere, they want to support the public system. That's where our taxes are going. And yet they're taking out the frustrations on the wrong people. Right. They're not able to. Mm-hmm.
Yeah. I know for us as optometrists, like we had a lot of changes with our OHIP regulations and things like that. So we're getting a lot of that, frustration. Well, why am I not covered by OHIP or why is this happening? So, a lot of this has I have never seen so many healthcare providers with anxiety or opening up about anxiety. And I myself, suffer from anxiety. And I never have before. So these are changes. I feel even anxious sometimes going to work, knowing that I'm going to be dealing with this daily. So, what are your recommendations or thoughts on healthcare providers that are going through these anxious periods at work, or strategies or coping mechanisms to help us?
Yeah, great question. So, I think there's a piece of it that's preventative in nature that we can talk about. And then there's also, what to do sort of in the moment. I think, I talk with a lot of my clients about vulnerability factors, like universal vulnerability factors. So for each and every one of us, it doesn't matter if you struggle with anxiety or don't, or if you struggle with depression or don't. When we haven't slept well, when we're not eating regularly, when we're not moving our body, when we're consuming, substances that aren't great for us, or when we're not taking our prescribed medications as directed, or when we're feeling physically unwell, all of those are universal vulnerability factors that will impact our propensity to feel a certain emotion or be triggered by something in a much greater degree. So, I think for all of us, it's, when you've had a bad night's sleep, you're much more triggered the next day. Or, the term hangry when you haven't eaten and you laugh out. For sure, for all of us, that's going to happen. So those are sort of some of the basic kind of, daily sort of checklist for you to manage in terms of a prevention standpoint is, how am I doing on all of these things? And self-care is looped into that as well. So what are the things that really fill up your energy bucket when work can be draining of that bucket? Right. So you want to try and be able to manage those things. And then I also think when it comes to patient interaction, there's even some prevention that can go into that, which is, how are we communicating to patients about the state of our healthcare system, about the services that we provide? When people have a chance to be prepared for those expectations, it can help them in terms of navigating it a little bit easier in the moment. So things like sending out a mailing or email blast to patients in your roster that basically says, this is what we're sort of facing right now. We're doing the best to try and meet the needs of our patient population in a quick and efficient manner. We ask also, for patience as we navigate this time. Usually that helps to lower a bit of the defenses kind of going in. Right. And that's true for any form of, communication between people. So I think those are things that we can work on at the outset. And then it's the sort of day to day, like how do you kind of manage day to day, and how do you deal with people that are coming in that are not always respectful, or that are, communicating a sense of entitlement. And it's not only patients, it can be staff that you have at your practice, and, how wearing a multitude of different hats at once. And so boundaries is really important, right? And I always tell people when it comes to boundaries.
What kind of boundaries? I want to know. What does that mean? Like, I would like to build a wall around me at work sometimes and be like, just no one talk to me, right? So what kind of boundaries? Like, so we understand what I'm setting.
Totally. So boundaries that's a great example. Everyone always wants to build a wall, but boundaries aren't actually a wall, okay? Boundaries are a little bit more like a window or a door, right? Okay. It's something that you can open, you can close, boundaries can be flexible. They don't need to be. So some boundaries are quite firm, and that's when you really know, I feel strongly about this. Like I'm not going to let, for instance, somebody come in and try and abuse me physically, right? That's like a hard line. So what are sort of some of those hard lines? So when you think about boundaries, you want to think about, what am I absolutely willing to tolerate, right? What am I absolutely not willing to tolerate? And then something in the middle, which is I need to figure that out, right? Those are the harder ones to get out. And boundaries can be emotional boundaries. They can be physical boundaries. So space, how close somebody is to you, right? They can be boundaries on time and energy. So what times in the working day am I opening myself up to communicate with patients or staff or other things like that, right? Each relationship, every single relationship we have, whether it's an intimate relationship with someone in our family, or whether it's, the person at the store checkout counter, we have boundaries with every single relationship that we have. And so it's sometimes helpful to think about those closer relationships you have, and like, what are those kinds of boundaries that I have in those relationships to make function effectively those relationships? How can I translate some of that into my practice? And so, is it the way patients speak to me? How do I communicate in a way that, provides reciprocation of that respect? Or if somebody does communicate in a verbally aggressive way, can I pre-plan sort of something that I can state that allows that boundary to be very clear to that person, which is, I'm going to have to, pause the appointment, or we're going to have to meet another day if this is how you continue speaking, that type of thing. So they can take lots of different forms, right? And they're highly individual. So you might have very different boundaries than the next person who's working in the same position as you.
So tell me, like, sometimes, like, I'll have patients that will, I'm their eye doctor, but they will they're not getting the help outside from their healthcare providers. They'll talk to me about other problems, right? Whether it's their depression or their whatnot. And obviously we want to lead them in the right direction and seek help where, they should be. But they want to talk about it with us. And, as healthcare providers, we don't want to pass people off. But it comes across as rude, or they get frustrated with us that, that doctor doesn't care, right? But that's not our expertise. So how do we set boundaries with those patients, right? Like, you can't just say, listen, I don't want to talk about this, or I can't talk about this because I'm not an expert in the area, because sometimes they'll come back at us and say, well, I know, but the other person is not listening to me, so we need you. So like, how do we set those boundaries but still come across like, yeah, we do care. It's not that we don't, we just don't know how to give advice, and don't want to give them the wrong advice, I guess would be the word.
Yeah, that's such a great example. It's like the foot in the door technique, right? Like once they get in with you, it's like, I'm just going to open up
Yeah.
Pandora's box
I know.
because
Can you check my teeth while you're at it?
yeah, I can't get in with my GP.
Right,
And we
right.
saw this a lot post-COVID
Yeah.
too, right? We
Yeah.
saw people
Yeah.
shopping around at trying to open up to, I mean, pharmacists got it a lot, right? With
Yes,
respect
yes,
to like
yes.
every medical
Absolutely.
condition. It was like,
Right.
diagnose me. Can't you prescribe this? I saw people getting verbally aggressive with pharmacists. It's like,
Yeah.
they've just recently gotten some prescription rights to, like
Wow.
before then they never had that. Yeah, I think that's a really hard one. And I think a lot of people are also feeling really lonely and feeling
Yeah.
really hopeless.
Yes.
And
Loneliness is a big
so
one.
when they get a healthcare provider, just a kind individual. And I think it speaks volumes to
Yeah.
who you are as a person. If somebody feels comfortable enough to sort of open up in that regard, it puts you in an uncomfortable position though at times,
Yeah.
right? Like you want to help, but at the same time, you probably have other people you need to see. One, it's also not your area of expertise. And two, it's not the service that you're providing to them, right? That they're
Yeah.
actually coming in for. So
Yeah.
you don't want to mislead them either. So I think a great way to really approach situations like this, and we talk about this as psychologists a lot with any form of communication when somebody is coming to you with something that is, might be more emotional in depth, and they're asking something of you that you might not be able to provide for them,
Yeah.
is start with a validating statement. So keep it really simple and just, you want to validate, you want to convey that you hear that this person is going through something or that they really want a listening ear. So sometimes even if you don't understand what they're going through, you can just say, it sounds like you've got a lot of really important things to talk about. And, I'm really invested in wanting to make sure that you find the right person to connect to about this. So, on your way out, I'm going to actually write down some names, or I'm going to direct you to some places that can offer you some support. So that might be sort of a quick and dirty way of kind of getting it done. Then there's, when somebody's like, sometimes people are like sobbing to you and they're, they've already opened things up and it's really hard to pack that in. We have to do it as psychologists in therapy sessions where it's like, you got the next person coming in. Okay, somebody breaks down and talks about their trauma in the last 10 minutes of a session. Ultimately, we do have to wrap up, and we can still do so in a respectful way. But saying things like, oh, this sounds super, super important. And, I'm mindful of the time. I'm mindful that you need to get connected to somebody that can really support you with this. So I'd rather actually, if you can come out with me, we'll make sure you get a list of some resources. And I think it's always helpful now for providers to have a list of various resources. So if it's a mental health thing, there's, the Canadian Psychological Association, the College of Psychologists of Ontario. Those are lots of places that they can go to look up providers. If it's for other medical needs, is, referring them to the College of Physicians and Surgeons or other places where redirecting them to their family physician. Other ways that they can get access to supports that they can walk away with. But I also think, and it's important to remember that when we model appropriate boundaries, that's really, really important for other people who might have a little bit too loose of their boundaries, right?
Right.
It helps to actually demonstrate to them that, okay, you're right. This isn't the person that I should be opening up to about, my depression right now and so on. But yeah, I understand that right now people are kind of gravitating towards anyone and anywhere that they can be listened to, right?
That's, yeah, definitely. So I find, that's great. No, thank you. So I find a lot of times, I have 3 kids, going home and taking it all in, going home and feeling things about yourself, right? I should have helped that person, or I could have helped that person more, or just hearing their stories of their depression or whatnot. You take it home. You take a lot of that home. And for me, I find it's very hard to separate work and my life, right? Or, and not even that, sometimes patients have gotten to a point where they're emailing us off the hook that why are these things not done in the last 2 hours, and we're at home with our family, or they're emailing us on a Sunday, hello, I'm looking for this. It's also on us that we've set those expectations that we used to do things that fast, but now obviously our focus is our well-being when we come home and our children and our families. So how do we restructure that and their thought process to have that work-life balance and also be seen as good healthcare providers?
Yeah, absolutely. Well, again, I think it comes back to those expectations. So, if you're finding you're getting those emails on weekends and evenings, that's a sign that, an email vacation responder needs to go up stat. And, a lot more people are doing this whereby, after the working hours, once they're going home with family, if their policy is that they're not going to get back to you until the next day, have that vacation responder on that says, thank you for your email. Truly care about sort of what you have to say. Basically, you can put it in your own kind of words. If this is an emergency, go to the emergency room. Otherwise, I look forward to getting back to you at the next business day. Or, there's lots of creative ways that you can write this, but that also might be something that patients are given when they come in to first see you is, what is the expectations around email communication? I know a lot of physicians struggle with this. We have physicians in our practice that come from a hospital setting where their email is never released, right, to any patient. And so navigating, okay, how does that work in a private setting? It's sort of like this expectation now from patients that I should be able to, if I'm paying for your service, I should be able to access you at any point in time. But that's not the case, right? As non-OHIP providers as well, we have boundaries and expectations that we have to talk through with our patients. And oftentimes it's saying things like, I know you were frustrated when I didn't get back to you, over the weekend, and it sounds like you were having a really hard time. And, these are the times when I am actually able to respond to emails, to check emails. And outside of these hours, unless it's an emergency, in which case I would direct you to the appropriate services, we come back and we discuss them in session, right? So it takes some behavioral shaping on the part of the provider to really establish that. And I mean, as I'll always say, I'm a DBT therapist, dialectical behavior therapy. We use a lot of behaviorist principles. When you crack in one moment, the floodgates open and people will continue to email you. So if you respond to that email on that off chance,
that's how I feel. Absolutely.
By God, they will email you again at 9 p.m. on a Friday and expect you to respond and give them a call. So start laying those expectations. And sometimes it has to come from, I know that in the past I've been able to email. My schedule has changed. And as a result of that, this is what I can offer in terms of my feedback. And this is when you can expect to hear back from me when you send me an email. Right. So even in the working days, right? When you're seeing patients back to back, they can't expect you to be checking email all the time in between. That doesn't give us time to be able to decompress between patients, to be able to have a bite to eat, right? All of these things that we need to help sustain us, right? And the other thing I'll say about that is this whole piece of bringing home work with you. And I had a prof once tell me that if you're in the healthcare profession, if you're not bringing a little bit of your clients or patients home with you, you're probably not in the right profession. The idea is that we care. Like we go into this profession because we care. And so I only say that not to say you should be taking stuff home, but rather give yourself permission and accept that a little bit of your patients, let's say the one that opened up to you and, was really looking for added support, kind of weighs on you a little bit. Give yourself permission to understand that a little bit of that is going to come home, but you also put a boundary around it. So you say, I can think about this for, 15 minutes on my car ride home or on the commute back home or, prior to me getting into the door at night. I've often recommended, especially for healthcare professionals, once you've made your commute back home, do like a walk around the block and just allow yourself to transition from work life to home. And whether that's unpacking, thinking about what it is that you've been bothered by in the day and remind yourself nothing needs to be solved tonight. I can come back to the office tomorrow and I can talk with my colleagues or I can reach out to somebody, but I'm going to put this aside for now. And I'm prepared to go back into my house.
So, sometimes, I mean, I love those points because a lot of them I don't do. So, we're going to start implementing that. But where do we reach a point like for healthcare providers? I have worked with many, colleagues who are in a state where, whether it's home life combined with, work life, little triggers from patients, whether it's them getting angry at them for, charging this fee or whatnot, have triggered, depression, anxiety. I mean, I think I've seen a doctor have an anxiety attack, they're stressed out, right? Like, what is that point where, you keep trying, you want to set those boundaries, but what's that point where they seek help? Like, how do we know as healthcare providers we need help? And I think most of us don't want to seek help because we feel we're amazing, right? Or we feel like, how could it be us? No, it's our patients that have it. So how do we know when to seek that help and that, what, enough is enough, I need help?
Yeah, I mean, the healthcare professional domain or that population in and of itself is like the hardest to tap into, to recruit, to come and seek the support, because in their mind, it's like, well, I know this. I should be doing this. I know what I need to do. I'm just not managing my time. There's excuse upon excuse upon excuse. Therapists are the worst in this regard, right? Like, the number of therapists I've seen who are severely depressed and have not reached out to anyone because it's like, well, I should know, or I'm ashamed because I'm struggling with something that I'm supporting people with, right?
Yeah, absolutely.
So first and foremost, got to cut through that shame, that what I call unjustified shame. You haven't done anything to break your moral code. You're just feeling badly about something. And really, it's a human condition that affects every single one of us. So it's never too early to seek help. I mean, I, as a psychologist, will see people with, severe depression, bipolar disorder, borderline personality disorder. I'll also see people who had a difficult Easter long weekend with family and it triggered some feelings for them and they want to talk through it, right? Yeah. There's no line in the sand that says now you deserve help. Everyone should be able to get, and hopefully one day they will be able to get access to some form of universal mental health care. But when it is really imperative is, of course, like when it's starting to impact other areas of your life. So you are starting to feel that you may be not able to cope as well with your work. Maybe it's rubbing off on family life in a way that is different than anything you've experienced before. Your kids are no longer bringing you the same joy, right? You're short-tempered, you have little patience, you're not sleeping well. Those sorts of things, when there's a characteristic change, is really a sign that there's more than just kind of low-grade mood going on, right? It's probably something that needs a little bit more support in the form of counseling and therapeutic strategies to sort of help you through. And it's so treatable, right? Depression, anxiety. We have wonderful evidence-based treatments for these, disorders now. And even if you don't, fit in within that category, there's still so many ways that we can support individuals and that you can actually start to feel better. And oftentimes it's like your patients, just being able to sit with somebody and unload. Right?
Yeah, without being judged. That's the biggest,
without being judged. Without being judged.
I think, correct me if I'm wrong, is stigma or being judged is probably the biggest barrier to seeking help?
Absolutely. Absolutely. It still is, despite all the efforts that we've made. Let's Talk Day, right? All of that. I mean, if you're on social media, the number of ads that you get that pop up around, reaching out about mental health. I mean, COVID, that turned the conversation to mental health, right? Everyone was struggling in some way and somehow. And yet we still face an enormous barrier due to stigma, oftentimes rooted in how people were raised, their immediate sort of social circles. So if you don't know as many people who have also sought help or, go see a therapist, things like that, it can feel a lot more daunting to do that yourself, right? And yet the stats are high, alarmingly high, how many people do seek support, many in silence. And that's something we work with them on. But yeah, it's unfortunately still a big barrier that we're fighting.
So tell me, like, where would someone who obviously has not gone through this and wants to seek help, but doesn't want to just Google it, like, where can they
Yeah.
go to seek help, right? Like, they're not going to go to another healthcare provider in their network that could be their friend. They want to go to someone else. But they also want to feel secure about that person and know I don't want to call it reviews, but know that that person is a good, person to talk to and a good therapist. So how do they find this person?
Yeah. So there's lots of great ways to go about finding support that you can do confidentially in your own home, right? That aren't just Googling. So, Psychology Today is a big platform, which actually houses a number of not only psychologists, but social workers, psychotherapists, all with varying degrees of training and expertise, and basically sort of almost lists their CV up on these pages, where you can then reach out and contact them and find out a little bit more about sort of the services that they offer. So that's sort of one domain, and you can really narrow it down, your search, by sort of geographical location. So you can look in particular areas of the city, of the country. I mean, it's all over North America. So you can really fine tune if you want to see somebody in person versus virtual. The Ontario Psychological Association, the College of Psychologists of Ontario does have a member search where you can look up based on sort of psychological issues that you're struggling with. I always say to people, make sure that whoever you're reaching out to offers you an opportunity to connect, to have a session without sort of any type of requirement to sign up. That's actually against our ethical code. Is
Oh,
to do
really?
like
Yeah.
like
Okay,
we
that's good
can't
to
sort
know.
of
Yeah.
take a fee and say, okay, you signed up for a membership. That's not what we do.
Okay.
We are a big part of our practice at Toronto Psychology Wellness Group is really finding a fit, because we do know that still one of the number one factors of therapeutic change has to do with the therapeutic fit between the therapist and the client.
Interesting.
So
Yeah.
finding somebody that you feel you can work with, who has the area of expertise that you're looking for, but also in today's day and age, whether you want to meet that person in person versus virtual, because there's a lot more virtual services offered now. It's really important that if you find somebody, you have a session, you didn't really click, that you're able to, and that you feel the ability to explore other options.
So when we're dealing, and let's just talk about this in particular, because this is what I see the most of is anxiety and maybe even depression going into suicidal thoughts. Like I see that a lot with colleagues. So excuse my ignorance, but who are they, like which therapist are they reaching out to? Are they reaching out to a psychologist? Are they reaching out to a psychotherapist? Who are they reaching out to? A social worker? Who would we be looking up?
I know, and I hear you. It's so confusing because you have all these different therapists, and a lot of people, the general public doesn't often know the distinction. So basically, all of those that you mentioned, psychologists, social workers, and psychotherapists, can all have experience in doing therapeutic work with clients within a specific sort of population, whether that's anxiety, suicidal ideation. Oftentimes you're working with clinicians that deal with both mood and anxiety disorders. Psychologists go through a doctoral program. They have the ability to diagnose a medical condition. That's sort of what separates them from social workers and psychotherapists.
Okay.
And they follow that evidence-based practice. So they're sort of looped in with the other healthcare professionals and being able to diagnose, go through, testing, psychodiagnostic assessments, although not always required in each case. I don't do that with every person that I meet. Social workers typically go through a master's degree, and then they have, internship following where they're doing therapy. So, previously a lot of people thought social workers, worked in sort of social services and things like that. Not the case. Yeah. We have many individuals that are working private practice, and then psychotherapists are now, as a regulated college of psychotherapy. They also typically, not always, they can come out from a bachelor's degree and then do basically required hours under supervision to become a psychotherapist. But all of those colleges or those healthcare professionals are sort of overseen by their respective colleges. So the College of Psychotherapists, the College of Social Work, and the College of Psychologists. Even OTs, some OTs have also undergone certain training to do therapy. Some physicians as well have the ability to also do therapy. So when you're looking at who you should see, a lot of it depends on, sometimes it's what your insurance covers too, right? So a lot of the time, looking into if you have private insurance, your insurance might cover a psychologist. Oftentimes that is sort of what it covers. Sometimes a psychotherapist, sometimes it only covers a social worker and a psychologist. So if you're using insurance or you plan to use some insurance, that's important to factor. But then it's really about, what is their area of specialization, right? So, making sure that that individual works with things like mood and anxiety disorders, right? Which typically loops in suicidal thoughts, suicidal ideation, individuals that practice within a cognitive behavioral therapy or a dialectical behavior therapy framework. So DBT, or dialectical behavior therapy, very specifically was kind of created to help originally individuals with borderline personality disorder, but has now been proven as an evidence-based treatment modality for depression and anxiety, eating disorders, wide range of disorders. But why I mention it is because with DBT, it really beautifully works at helping to shift cognitions and behavior associated with things like suicidal ideation, self-harming behavior. So for individuals who are struggling with that, DBT is a really nice modality. We call it sort of CBT's older, cooler cousin. It sort of took the traditional approach of CBT and sort of augmented it a bit. It incorporates skills like mindfulness, distress tolerance, emotion regulation, interpersonal effectiveness. So it's a really nice, almost like life skills. But when somebody is really struggling, it is proven to be really, really effective in helping them to work through those more intense emotional responses.
And that's something offered by all three providers?
All three providers can do DBT. It's important to note that, not every psychologist has DBT training, just like not every psychotherapist does. So you want to make sure that when you're looking up the therapist that you are, interested in seeing, that you see what their primary modalities. And typically if you're looking on something like Psychology Today, or if you find a therapist on a website through one of the colleges, they will list sort of the approaches that they work within. Right? So emotion-focused therapy, cognitive behavioral therapy, dialectical behavior therapy, psychodynamic therapy. So different sort of approaches. So you really want to keep your eye out for things like CBT and DBT.
So tell me, because you're awesome, obviously, if someone came to your practice and obviously does not know, what kind of therapy they need, they just know that I have these feelings, I can't sleep at night, my behaviors have changed, and they come to your practice and say they book a session with yourself or another provider there, and they're like, no, listen, this is not my expertise, then you guys would shift them amongst each other. Okay.
Yeah. And what we do is prior to, and most larger practices will function in this way, is prior to even getting set up with a therapist, we actually have clients or prospective clients fill out a pretty detailed form, which is sometimes followed up with a call from one of our intake care coordinators who will clarify some things on the form. And the purpose of that form is to find out all of those things. What are you struggling with? What are you looking for? What are your preferences? Do you want to use insurance? What days are you available? All of those things. So we take that information and we say, okay, this person is particularly well suited for these few people. Here are some options. Who might you like to pick from those options? So you can peruse their profiles. And then when you meet with them, with every therapist, really, I think, any person that anyone goes to should really begin any session, and it's a red flag if they don't, with things like consent and confidentiality. So what's the consent to beginning treatment with them, that they can end treatment at any point in time, that the first session is really just kind of a get to know you session.
Right.
How does it feel? And if we think, and part of our commitment is, if we don't think that we can, support that individual. So if somebody comes in to see me and they might be having some episode of psychosis, which is not something that I work with in private practice, I would make every effort to connect them to the appropriate service provider that could support them in that regard.
Excellent. That was a lot for me to take in, and I'm sure our listeners and viewers. But, tell us, where can we find you? Where can our listeners and viewers find you? You're awesome, and a lot of people might be lost and want to connect with your practice, being local as well. So where can we find you? Yeah. Like social media as well as, practice-wise?
Yeah. Yep. So we're conveniently located at Yonge and Lawrence. So we have 2 large office suites up on the 5th floor. We have a number of lovely clinicians, office managers, intake coordinators who will greet people. You can stop by in there, but you can also conveniently find us on our website, www.tpwg.ca. We're also on Instagram, and we like to put out a lot of informative videos about our services that we offer, who we are. We're trying to connect more to people because we know that that's something that people want to see. They want to get to know who their therapist is and what are sort of the modalities that they use and how do they speak and talk to people. We do work with a lot of healthcare providers, and it goes without saying that our services are strictly confidential. So we take the utmost care in making sure that there's sometimes people, physicians coming from hospitals nearby, and they're concerned about maybe running into patients and things like that. Yeah. So we make sure to ensure that their privacy is protected at sort of all costs. But yeah, so you can check us out there. You can also give us a call, and we're always happy to connect with people.
Excellent. I am a Instagram follower of you guys, so
wonderful.
I have to say I love your videos.
Thank you.
But no, thank you, Dr. Mafrici. This was phenomenal. Lot of great advice for our listeners and viewers, and we hope that some of them will soak it all in and connect with your clinic and seek help if they need to. So thank you for your time.
Well, thank you for having me. I always love talking about this stuff, and it's always helpful to hear more healthcare practitioners who are shedding light on an issue that all of us face, right? And that we all need support with from time to time.
Yeah. Thank you.